Hello everyone. We all know about the common symptoms of COVID-19 infection, which are fever, cough, shortness of breath. But now there are new COVID symptoms which you should not ignore. So let's see what are those new symptoms. First one is dry mouth or xerostomia. COVID-19 has been suggested to cause dry mouth for a variety of reasons. The most common is mouth breathing by an individual due to mask use. Mouth breathing can desiccate oral tissue, especially without frequent hydration. Studies suggest that another biological mechanism involves viral entry into the salivary glands. This is because salivary glands have abundant angiotensin converting enzyme 2 receptors. Probably you already heard about these SCE2 receptors. SARS-CoV-2 virus uses this cell surface receptor to get into the cell. So due to abundance of SCE2 receptors, salivary glands are one of the main targets of coronavirus. But you should remember that dry mouth can cause due to various other reasons like low intake of fluid, hot weather, side effects of various medications. Next one is mouth ulcer. You can see painful mouth ulcer mostly on tongue, lips and palate. This ulceration can be because of systemic effect in our body due to coronavirus infection. Some studies suggest that virus uses the SCE2 receptors present on the cells surrounding the blood vessels and damage them, which leads to oxygen deprivation, localized tissue necrosis, and eventually ulceration. Here you should remember that mouth ulcer can be seen due to different reasons. So consider other symptoms if you have mouth ulcers. Next is COVID tongue. COVID tongue is a condition where tongue becomes white and patchy. Here you can see the cases published in British Journal of Dermatology. In the first picture, there is glossitis and anterior transient lingual papillitis due to swelling of the tongue. And here in the second picture, you can see glossitis with patchy depapillation. However, some other conditions can be easily confused with COVID tongue. Here you can see two other conditions. First one is called geographic tongue. It is normally found in many people. And second one is median rhomboid glossitis. It is due to candidiasis, a type of fungal infection. So again, you should always correlate with the other associated symptoms. Lot of the patients are reporting with low-grade fever and body ache. Few patients are experiencing severe body, joint and muscle pain. Diarrhea can be the first symptom of COVID-19. Some people may experience diarrhea without other flu-like symptoms like fever. Vomiting is also a common new symptom, however it is more common in children than adults. Lastly, we would like to mention two peculiar symptoms like loss of taste and loss of smell. A sudden onset of loss of taste and smell are two symptoms that can be the earliest indicator of COVID-19. An average of 47% of individuals who tested positive for COVID-19 can have subjective complaints of taste and smell loss, particularly in case of asymptomatic or mild disease. The mechanism behind this loss is suspected to be viral disruption of cranial nerves 1, 7, 9 and 10, as well as the supporting cells of neural transmission. This is because the tongue has an abundance of SCE2 receptors, so direct viral entry into the tongue cells is possible. As per a study in China, red eye or conjunctivitis could also be a sign of COVID-19 infection. Hope you find this video helpful. Spread this information to your loved ones. Share this video and don't forget to subscribe the channel. Thank you.